Good morning. My name is Dr. Gorata Kuda Witness. I'm a medical officer in Botswana, currently placed in Mahalapedi HMT. I'm a medical officer in public sector. I completed a postgraduate diploma in dermatology and clinical practice and also a master's in science in dermatology and clinical practice, which was sponsored by Merck Foundation under the advancement capacity program. I completed it at University of South Wales, and the postgraduate diploma was in 2022, the master's in science in 2023. And the course was an online program at the University of South Wales. I'll say the course content, it was really comprehensive, and the staff as well, they were really comprehensive and supportive. I particularly really enjoyed it and learned a lot. So I also appreciate that even throughout the course we had a FUCA person, Merck Foundation, who was always checking up, so that was really helpful as well. Since completing the course, actually when I was still doing the course, I initiated a dermatology clinic and clinical practice. I initially used to get outreach assistance from the dermatologist from the referral center, but now since she relocated, we are able to get a dermatologist. So with her trust through the practical skills that I gained from her and also the theoretical skills from the course, I'm able to run the clinic solo now. So even though it's a little impact because I'm only just one person covering a huge district, but we have managed to reduce waiting time for patients. We've managed to reduce referral to the tertiary hospital. We've also managed to reduce traveling costs to the hospital as well as to the patients. So as an aspiring dermatologist, so dermatology in our country, maybe in the continent or even in the world at large, it's an underserved specialty. So it's really hard to get sponsorship for dermatological cases. So with Merck Foundation sponsored me to do this course, the theory that I learned from the online course and as well the practical knowledge from the dermatologist who was mentoring me, were able to initiate the clinic and were able to see a lot of patients, reduce most of the patients didn't need to travel and reduce most of the complications. However, it's also important to know that the cases that don't respond initially or complicated cases, I still do refer to the tertiary dermatologist. Yeah, so I'll say not really challenging per se because now I have this newfound added information from the dermatologist, but there are a lot of patients who have been seen so many times in our primary care, which now I'm able to see, and we are able to have patients who recover immediately or who are better managed. For instance, cases like atopic dermatitis, there are a lot of those cases, but the problem is the management because initially we are not really aware much of how to manage them. And also one of the things are patients with albinism and vitiligo, we are able to properly follow them now and also able to counsel them and follow them in a multidisciplinary team format. So I think that has been really beneficial with the newfound knowledge in dermatology. Yeah, I'll most definitely refer my colleagues because the course was really comprehensive and it's also easy to follow, easy to balance, fairly easy, not actually really easy, but fairly easy to balance with the work schedule because you don't need to go anywhere since it's online. Yeah, I would like to thank Merck Foundation for the sponsorship. As I've said previously, that dermatology is really an underserved specialty. So having the opportunity to have them having sponsored me for this course, I'm able to really make significant impacts in the patient that I see and the better the healthcare system, especially in primary care for our district. So I hope to continue with dermatology and do a master's in medicine dermatology, and hope Merck to also sponsor me to do that and become a fully fledged dermatologist. But all in all, I'm really truly grateful to Merck Foundation. Thank you.